Will there be a second wave? Do we feel safe? Join Tim Seaman now as he discusses these questions live. Coronavirus, adjusting to a new normal.
And good evening. Thanks for staying with us tonight for this KCAU-9 Town Hall. Coronavirus, adjusting to a new normal. I'm Tim Seaman. Since March, when the virus really started to make its way across Siouxland, we have hosted 4 of these town halls, each offering insight into issues affecting people at that given time. And tonight we hope to do the same thing. What's the status of COVID-19 in our community, and where are we headed in the weeks and months to come? And to get started tonight, let's take a look at the coronavirus cases in the tri-state area, comparing the numbers tonight from back in March when we first got together, back on March 18th. Iowa reported just 38 cases. 3 months later, more than 26,000 cases, 688 deaths. In Nebraska, 24 cases back in March, but now nearly 18,000. And in South Dakota, just 11 cases 3 months ago. Now there have been a total of more than 6,300 and 81 deaths now in South Dakota as well. And now a model cited by federal health officials has set a new prediction mark for the United States coming up in September. By October 1st, Iowa will record more than 1,200 total deaths from the virus, at least according to this statistical data, while Nebraska will see more than 600, South Dakota with 180 total deaths. The numbers are indeed a bit staggering there as we take a look at those tonight. And so as we dive into the numbers as well as what is ahead of us, I want to welcome our guests in the studio with me again this evening. Nearest to me, the Executive Director of the Siouxland Chamber of Commerce, Chris McGowan. In the center, joining us this evening from Mercy One Siouxland, the Chief of Staff there, Dr. Larry Bowles. Doctor, thanks for coming back, seeing you again. And also joining us tonight from the Siouxland District Health Department, the Director of Health there, Kevin Green. And Kevin, thanks for taking time out of your night to join us this evening. I want to start with you. Those numbers that we continue to see about projections down the road. I know your focal point is really right here in Siouxland and at home, but is there still a chance we could see those numbers just continue to grow to those unbelievable totals?
I mean, even in Woodbury County, we're pleased to see we get double digits or single digit increase in cases every day.
Right.
But the reality of it is we're still getting more cases. And I think we're looking across the state of Iowa, what we're beginning to see is some of those areas that were originally level of effect, they're now beginning to gather some of the cases within it. And I think really from a public health perspective, what our concern is, as we begin to expand capacity, people's mobility, more opportunities to interact, we're seeing larger groups of people gather together. Our concern is then that there's more transmission, which results in more cases.
And we'll get into how that affects the hospitals as well as local businesses here as we continue. But before we go any further, I do want to remind folks at home that if you have a question that you might be debating in your own head, we'd welcome you to send that information to us on Facebook. You see the information right there. We'll try to pass along some of those questions tonight before we wrap up our town hall session. We've seen a steady decrease in the numbers of illnesses related to COVID-19 in the local community, as Kevin just mentioned. Just 5 new cases out of 121 new tests. That's the total out today from Siouxland District Health, with 42 deaths, the total number that's been reported locally. Hospital cases now just 32, according to Unity Point, St. Luke's, and Mercy One, which again is a number that's headed in the right direction. So I'm going to start by this, just throw the broad question out to all of you. What do we know now that, at least for 2 of you gentlemen, we didn't know when we were together 6 weeks ago? Obviously, we know a lot more than we did back in March. Chris, why don't you get us started here with what we know in our own business community?
Well, I think first and foremost, Tim, I'd like to thank you for the opportunity to appear with Mr. Green and Dr. Voles, 2 outstanding individuals that we're very fortunate to have in our community helping lead us through this coronavirus pandemic. That said, I think the first thing that we've learned that we know that maybe we didn't know 6 weeks ago, or maybe a little bit more than that, is that we can manage this successfully if we follow the recommendations. I always had confidence in Siouxland. My first appearance in this studio to talk about coronavirus was on St. Patrick's Day on March 17th. At that time, I said, Siouxland always steps up in a crisis. We have a track record, whether it's floods, whether it's a plane crash, whether it's a tragedy of another sort. The character and caliber of the people of this community is revealed. I sensed and predicted that that would be the case with this. I think that's certainly what has transpired. I think that both Larry and Kevin would confirm that. To the extent that we're able to do so, Siouxlanders have followed the recommendations of the CDC. They followed the recommendations of Siouxland District Health. They followed the directions of our local healthcare professionals, and we have weathered this perhaps better than some because of that attention to detail.
Dr. Voles, we know that your staff has been through the worst of it, at least to this point, as your hospitalization numbers continue to come down.
Yeah, so I think the thing that we have learned from this is I think you gain experience from treating these patients. And I think we understood that these patients could get very sick. And I don't think you fully understand that until you're really in the heat of taking care of these patients. And I think just as this has progressed, I think we learned medical treatment improvements from what they had learned from China and from Europe. And I think the longer this has progressed, as we've learned more about how to manage patients, what patients do well with treatment. And I think more recently we've had more data showing things that we thought were initially successful treatments, like hydroxychloroquine had gotten a lot of press early on that we were using that, and we found that that's really not beneficial and may be causing problems. And now more recently there have been some studies around dexamethasone, a different type of medicine that we're using that is now real data that we show that is beneficial in treatment. So I think gaining just confidence in being able to manage these patients on a day-to-day basis, and really I think to sort of echo what Chris had said, realizing that our staff and our community is really capable of handling this, that we've had, been able to really expand and absorb some of that. And I think we knew we could do it, and getting through this, realized the capabilities that we really did have.
And Kevin, I think the reason that has been the case is because people have bought in to the information that has been relayed as far as here's how we do it.
Right. I think when we started out originally, there was a lot of discussion about surface contaminations, transmission of that. And as we really took a look and moved forward as our cases evolved, we really looked at those close contacts. We wanted to start with the household. We looked in the workplace, those types of things. Now, as we've evolved out, I really look at the surfaces as a secondary issue. It's really that respiration and the transmission of it through that way. And how do we limit some of those things? I think things that we have that is the impact of some of the mass gatherings having and the implications that'll have for more cases. And I think those are all things that have evolved along the way. And the other part is that we've gone through this whole journey, and every day you have to read the guidelines again, because there are new learnings, new evidence out there that they're changing those from a national level through the CDC. So it's keeping abreast of those, because we had many conversations with entities and individuals on a Monday. By Thursday, it was almost like, do we have the time to call them back to reinform them of the newest development? The latest is what it is. So we had to rely on the media, I guess, to get some more of that information out and share that on a broad base.
Dr. Voles, I think another of the things that we certainly have learned a lot about is the asymptomatic cases. At least in my opinion, early on, it seemed to be almost an afterthought of, oh, by the way, you may not show symptoms. It seems like there are more and more cases that are being reported as asymptomatic.
I think we see that more now that screening, initially on we didn't have really good testing. Testing was so delayed, and we were only testing patients that were symptomatic. As we started to open up, now we're testing almost every patient that's coming in now for a hospital procedure. And so we're really getting a sense as to what that asymptomatic number is. And it's low, but we are finding people that would be coming into the hospital and having surgery and placing staff at risk that we are identifying ahead of time, and we're able to keep them at home and quarantine them. So I think that's the advantage of really being able to increase the number of screening tests that we're doing, is identifying what that asymptomatic number is.
As we see the numbers continue to come down locally, much of the discussion is about what's next, what is ahead of us, and that leads right into a second wave or a new surge of these cases. So, Kevin, I guess I turn to you, and your other two gentlemen obviously jump in, but how concerned should we be right now of that second wave? Is it a foregone conclusion there will be one, or is that still up for debate?
Really the discussion has been, is the first wave over? I mean, it's gone, it's declined, decreased, that sort of stuff. I'm anticipating, as we take a look at, there is going to be an increase in cases. It's bound to happen. When you look at the number of the residents that have actively had it and recovered from it, that's probably a low number. We're also interested in another indicator that'll be is when the serology tests, we get more of a basis with that, because that'll show us who's had it, may not even known it, and recovered from it because of the prevalence of the antibodies within their system. And I think those are some of the things that'll also give us sort of a hindsight as far as maybe cases we didn't pick up as a positive through the current testing and that type of thing that were here. That'll give us more relative to say, okay, what's the protective nature in that? And what do we see for the future? But I really am anticipating later on this summer into fall, there probably will be an increase in the number of cases. But I think the big thing is, how do we then contain that and minimize the impact of that?
I want to take a look at one of the Facebook polls that we conducted in the days leading up to tonight's coronavirus town hall, checking in with our viewers to give their opinions on some different things. And viewer question as well. This is one question that we had come in. I want to get an antivirus test. Are the tests being offered locally reliable at this point? I think that we've proven that the tests are available, and we continue to see solid data from those tests.
We're perceiving that those that want a test have the access to get a test. You know, what's gone on with the consortium, Siouxland Community Health Center, that network of healthcare providers that are actively doing the testing. I mean, what I have now requested from our state testing system is actually a summary. And so when I look at the total number of tests given to Woodbury County residents, there are between almost 17,000 tests that have been done. And what's interesting to me is I've gone through and assessed and kind of reviewed those. Some individuals have had up to 6 tests individually. And so that's a mixture of both the positive and the negative. So it lends me to believe that if you want to get a test, the access and the availability is there. Some people feel there's a barrier with, say, in health insurance, but Siouxland Community Health Center can walk individuals through that process to assure that they can be tested. So I think it's pretty widely available, and we're really looking at continuing with that. And so I think people that think there's not access, I think they just need to call and check.
Well, if you look at the numbers that you release on a daily basis, more than 100 cases, tests is what I'm seeing on a daily basis, more than 100.
Right. And what we're looking at then within that, and see, this is what's interesting is, as we've tracked the data, the stuff that I'm looking at goes back to the collection date, because those tests actively that we reported today, probably ones that were administered, the specimen was collected last week. And so I go back to the collection date that puts it back to that actual number of tests that have occurred within a week. And so far at this point in time, we've been on about that cusp of right around 1,000 per week for sure that have actually occurred with this network of providers that are in the community. And so as we look at continuing that, that gives us a great opportunity to monitor and try to determine what our trends are. What direction are we heading?
We want to talk more about the medical direction, but also the business direction locally as our community begins to come back to life. The small businesses continue to open their doors and welcome new customers, what the customers can expect and what those business owners should expect as well. We also want to touch base about moving forward, how the state of Iowa is doing that. And just earlier this week, a member of Mr. McGowan's Siouxland Chamber of Commerce was appointed to a state advisory committee by Governor Reynolds. Governor Reynolds said that that board will chart a course for Iowa's economic comeback, something that is already underway. And that group also will assess the economic impact of COVID-19 on Iowa businesses and analyze the recommended recovery efforts. Ruan Transportation CEO Ben McLean is the chairman of that board, and he and 13 other business leaders, including Barbara Sloniker from the Siouxland Chamber of Commerce, are included. He had this to say about what their work will be.
Iowans have always been resilient. Even in the toughest times, we do not shy away from a challenge. Instead, we persevere. We innovate, we engineer, we implement systems that will enable us to emerge from difficult times stronger than we've ever been before. And this time will be no different.
And so I want Chris to comment on that and the fact that Barbara Sloniker will be on board. I also want to ask you, the latest unemployment numbers show that unemployment has dropped in all but 4 of Iowa's counties, but according to the Iowa Workforce Department, they show that Sioux City is still 5,000 jobs in the deficit today from before the pandemic hit. So your thoughts on that as well as your participation?
So a couple of issues there, Tim. First and foremost, we're incredibly proud to have Barbara Sloniker, our Executive Vice President, serving on Governor Reynolds' Economic Recovery Advisory Board. She'll do a great job not only representing Western Iowa, but the nearly 1,400 businesses that are members of the Siouxland Chamber of Commerce, and that's big business, small business, mom and pop, ownership, all kinds of different ownership scenarios. So she'll be a great advocate for businesses in this part of the state. Secondly, as we look at those unemployment numbers, we know that we went into COVID with a leading concern in economic development related to where are we going to find the employees to continue our economic growth. In early March of this year, Siouxland was recognized as the top economic development community in the United States for populations under 200,000. It's the eighth time that we've received that distinction and ranking in the last 12 or 13 years. So we were focused on where are we going to find the labor. Now we see that that has changed dramatically, but it's still a priority for us to make sure that those individuals who are looking, seeking employment opportunities, are connected with those who continue to need labor. That's one of the roles that we play at both the Siouxland Chamber of Commerce and the Siouxland Initiative, and we will, of course, continue to do so.
Dr. Voles, when you talk about employment ramping back up, people coming back into businesses, both of you maybe some recommendations for not only the employers that have new standards to meet, but myself as a consumer, I think there's new expectations as I walk into a door as well.
Yeah, I think those expectations, I think everyone understands them. I just don't feel like we're following them necessarily in our community here. I think the things that we're expecting everyone is to still try and maintain social distancing. I think a lot of businesses are doing a really good job of encouraging their customers to be able to still social distance, putting spots on the ground, arrows around which aisles to go down. But I think people in general still are not necessarily respecting that. We need them to still social distance and wash your hands and wear your masks when you're out. I think that's how we are able, that's going to be our biggest stimulus, to be able to get businesses back open by staying flat, keeping the virus at bay. And if those numbers stay low, we'll be more comfortable opening up businesses. But if we don't do this safely, I think we'll end up talking about this, you know, this second surge and then the second economic impact, which I think would be worse.
Kevin?
Right, and just to follow up with that, I think one of the things that we're really trying to figure out how to help people understand, the masking is something that should be done on a voluntary basis. It's not necessarily done because it's a restrictive nature imposed by someone, but it is a protective nature and the right thing to do to limit the transmission of it. And I think what we're really worried about is the general population maybe not following that guideline. For some reason, they don't accept that as something, but you know, it's become the reality of the fact of that is one distinct way to reduce those. And I think just people accepting it, that it becomes a norm. I mean, there are many things as far as what's socially acceptable when you go out in public. Well, maybe the mask needs to fall in that category. And that's just something we do for a period of time. I think many of the things that some of the businesses have done to open up to really protect their workers, I mean, that's an era we're in. We are now beginning to reopen for services. We're looking at again barriers between the clients and our staff so that they make sure that there's less risk of transmission. We're trying to do the social distancing, monitoring, and reduce the number of people that are in our waiting room so it doesn't get overcrowded. Those are all things that we're incorporating as a health type facility, and I think that's what's going on across the community. But I think what we have to ask is the general public out there for their cooperation and understanding as why we're doing this.
And perhaps it can be looked at as simply as it's not a me thing as much as it is a we thing. We as a group need to do those types of things to make sure we stay on a positive track. I want to take a look at a poll result that we took from our viewers. I mentioned a moment ago, and here's one of those. Do you agree with the reopening in Siouxland? It's about 50-50 there. It's probably about what you would expect. And Chris, as you continue to see your businesses open their doors, of course, movie theaters really have not opened their doors yet. Our large entertainment venues have opened their doors but are looking for content at this point, I guess. Give us a sense of how small business Siouxland is doing today versus maybe 6 weeks ago when we were last together.
Well, this has been an extremely challenging time for all of our small businesses, and we certainly understand and appreciate that. And we want to make sure that we're doing all that we can to support them, and that means supporting those businesses with our financial resources, going to dinner, taking takeout, going to retail establishments, and that is the definition of reopening the economy. Now, can we do that in a way that is consistent with the measures that Dr. Voles and Mr. Green have asked us to do so, or the guidelines they've asked us to follow? And the answer is absolutely. The reality is that we have to balance economic health with physical health, and both of these gentlemen have tremendous expertise talking about how we can maintain our safety, our health, and our wellness. But part of that conversation needs to be our economic health and well-being as well. That's critically important. We're trying to balance those interests. I personally believe that Siouxlanders can do an outstanding job supporting those businesses, going to the grocery store, wearing a mask, but also recognizing that we can open up, that we can begin to spend money, that we can support those small businesses that have been struggling while following those guidelines.
One of those businesses that will continue to ramp up is the airline industry. And of course, we have limited daily flights through here. It's not a major airport by any stretch. But what recommendation might you give to someone that is going to be traveling via the air in the coming days? We see more and more flights, and there's a lot of discussion that the airline industry, at least immediately, is going to be more of a business industry as needed versus a pleasure, but people will continue to jump on board as numbers drop. So recommendations for people that will be flying or traveling.
I think they just have to be aware of the groups that they're on. I mean, if they're going into a terminal, is there some place they can still keep themselves somewhat contained and social distance from that? Wearing the mask is important, sanitizer along with it. Continue to do those sort of personal hygiene types. The airlines are just as interested in getting their customers to return to. They're trying to do everything they can to make it as safe as possible. I think one of the challenges that they have, just like all of us, is they can't always take into consideration the human factor, the people's choice to be able to understand and be cooperative in what they're doing. And I think those are things that can impact other individuals that are choosing to travel in that way.
Dr. Bowles?
Yeah, I agree with that. I mean, I think the airlines opening up like we are opening up the rest of the economy there's a safe way to do that. And it really comes down to our general population wanting to accept the fact that this is going to be a different way we have to travel now. And wearing a mask on the plane may not be what you really want to do. And not, you know, and I think in the terminals are going to be a scary part too. There's so many people gathering there. It's just really making sure we're spreading out. And I don't think anyone feels comfortable sitting in a big packed waiting room anymore. So I think we can do it safely as long as we're being smart about it like we are the rest of the economy.
I've got to believe that your staff is breathing a bit of a sigh of relief as we've seen your case counts go from the mid-90s now to the low 30s. Are you getting a chance for your staff to do that?
You know, absolutely. At the peak of our surge, it was stressful on the organization, and more importantly, stressful on our individual providers, the physicians, the nurses, everyone that is coming in contact with that through the ER or ICU or on the floor. I think it was emotionally straining. It's hard on their families and taking care of these sick patients. And so now to be to a point where our numbers are low enough that we are, much more in our groove of our numbers where we're able to do this much easier is great. You can sense the sort of the stress and the wear and tear on the staff is dropping, I think, just on the organization in general. So it's good to be talking about how are we going to sort of start walking out of this, starting to reopening up, doing what we do every other day, doing elective surgery and procedures, and that part's exciting for us as the numbers are coming down. So
talked earlier about what we know today that we didn't know before. I'm just curious. I know you've had patients that have been in as little as a couple of days, patients that have been there for longer than a month. Can you address that difference, and is there that great of a difference in the infection in people?
Yeah, I mean, I think the challenge with COVID is that we have, 80 or 90% of the people, don't ever even have to come into the hospital. And how many of those are asymptomatic? That we don't even really know that number exactly yet. But the patients that come into the hospital, once you get into that group and you need supplemental oxygen and you're really sort of struggling to breathe and getting sick, there's a big difference in that. I mean, we have some people that just come in for a few days, and then we have some people that are on a ventilator for 30 days. And so it's very unusual, the disease, in that fact of how you can be from people that are so critically ill. And these are some of the sickest people that we see. And we have intensive care doctors that have come in from around the country to be able to help manage the number of patients that we've had. And they are all shocked at how sick these people are and how difficult they are to manage once they get critically ill like that.
Are you able to describe at this point how sick asymptomatic people actually are? Is there a degree of sickness there?
Well, if they're asymptomatic, technically they're not having any symptoms at all. We would have no way of really knowing that they were even ill. And like I mentioned earlier, when we were testing patients that had come in for elective surgery, if they have symptoms, we're not even testing them because they wouldn't have their operation. So these people really have no symptoms and have no idea that they're sick and are probably thinking it's a waste of their time to be tested, and their test is coming back positive.
I want to take time to check another viewer question that we had from earlier today, someone that had submitted, and we'll share that with our panel as well to let them take a look at this. I'm trying to be more social while observing distancing rules. How long can I be near an infected person and not become infected myself? Is that something we know at this point, Kevin?
When we take a look at a close contact, it's anything that you've been in no protective nature, no mask or anything that's on, less than 6 feet, and it's 15 minutes in any one day. And that's kind of cumulative minutes is what it would be over a period of time. So even in standing, if you were in a crowded area standing in line, that you have to wait that 15 minutes and it's around a positive case, you could actually have been exposed and potentially then contract it. If there's no barriers in there such as masks and that type of stuff. So that's really been what it's evolved into, is that it used to be 30 minutes, as we talked about what we've learned since then. They've reduced that down to 15. And so when you look at your normal world of work and where you socialize and what you do, when you get it down down, condensed at 15 minutes, how many times and how many people are you in close contact with for that duration of time?
Dr. Voles, can you give us an update on where you're at, where the industry is at as far as testing? Talk about viral testing, the disease versus antibody testing. Is that a reliable test that's out there now?
So the testing that we have now from the testing for the virus, we have more reliable testing now. The testing that we have now is a very high sensitivity and specificity, meaning that when you get that test, it's pretty likely if you're positive, you're really positive, and if you're negative, it's pretty close that you're negative. And we have testing now that's really rapid. We have tests that turn around in 45 minutes to an hour. Okay. But those numbers, the ability to be able to get enough of those tests is limited. So we have to only use those tests in certain cases that we need to know right away. As far as the antibody testing goes, I think that is becoming much more prevalent and more reliable. The challenge with the antibody testing is we don't know what implications that means. If you have the antibody, it just tells you that you may have been infected, but it doesn't necessarily provide any additional useful information, meaning that you don't necessarily have a mask. We're not sure whether you can contract it again or whether you can carry the virus again. So there's a lot of information around that. So just because you tested positive for the antibody or even had COVID before doesn't necessarily mean that you're safe.
We're just about out of time. Once again, it's amazing how fast a half hour can go. Quickly, each of you, one last thought. Chris, I'll start with you.
You know, I would just say this, Tim. We're incredibly grateful to KCAU for the role that you've played throughout. I want to thank Larry and Kevin for their work. And we have consistently tried to make a point of thanking those frontline healthcare workers. Larry and Kevin both work very closely with them. On behalf of a grateful community, we really appreciate the sacrifice that you've made, that your family has made to keep us safe. Those frontline healthcare workers should be joined with thanks to our grocery store personnel, our truck drivers, police, firefighters, first responders. Everybody kind of came together, and we're incredibly grateful.
Great. I think my final comment is I think, you know, I'm incredibly proud for how the organizations have done here in town, what our community has done to support us through this, through public health, and what businesses are doing to protect that. And I hope that our community continues to support and follow those distances so we can really get back to normal living here in the near future and we don't end up having to have a second surge.
I think the most impressive thing that we've learned is we've partnered with people over the years, but throughout all of this, I think one of the things is they want us all to be successful. They're looking for the guidance. They want to know how to protect. They're concerned about our residents, and I think that's been widespread. And so seeking our guidance and information, we've been happy to share that, and we think it's having a positive impact.
Thank you, Kevin. Thank you, Dr. Voles and Chris as well, all for being with us again tonight. And thank you for joining us. We hope that you've learned something tonight and take it with you in these days as we move forward. Good night for now.